Looking to switch your career? Become a data
Hoy, sino Leo? Sino tayo?
Hello, good morning, everyone. Yeah, good morning.
Morning,
Good morning,
sir.
sir.
Morning, sir.
Yes, you may take your break first. You may take your break first, and we will start our discussions at 10 o'clock. Okay lang?
Yes, sir.
Yan, 10 o'clock tayo
Okay,
mag-start
sir.
ng lecture. Break muna kayo. Thank you very much.
Okay, sir.
Recording in progress.
Hello, good morning again, everyone.
Morning, sir. Morning, sir.
Morning, sir.
Good morning, sir.
Ibang kulay mo nga, hindi puti. Okay, and let's start with our discussions in radiographic procedures and techniques. Mahirap ba? Madali lang, di ba? Yan. And please be reminded again dito sa ating dynamic online na the recorded lecture or the recorded video ay mai-access nyo lang ito after na ng ating dynamic lecture or dynamic review. Meron tayong schedule when you are going to access itong mga lecture, mga recorded video. Don't worry, may mga subjects pa naman tayo, so focus muna tayo doon sa mga scheduled subjects na dito sa dynamic online. Yung mga natapos na ay antay lang, dahil may nakaschedule tayo. Mapi-play lang ulit or makaka-access lang ulit kayo dito sa recorded video natin at the end of the dynamic. So may mga schedules tayo. Or pwede kayong maka-access ng video anytime you want after the dynamic. Dahil how many days more to go ang ating face-to-face lecture. Okay, number 1. Okay, number 1, the question. Excuse me. For RAO possession of the esophagus. So in esophagography or esophagogram, we call that also as barium swallow. So pag sinabi nating esophagography or esophagogram, that is also known as barium swallow. And there are different projections for the demonstration of the esophagus. And one of the projection is the right anterior oblique. So for the right anterior oblique, ano daw ba ang posisyon ng pasyente? Is that the patient is rotated obliquely by elevation of the right side? So pag sinabi nating right anterior oblique, in other words, the patient is in prone position or it is in supine position. Wait lang.
Prone, sir.
Yes po. Wait lang po sandali. Okay, so the patient here is in prone position. Pag sinabi nating right anterior oblique or left anterior oblique, the patient here is in prone position. Pag sinabi nating right posterior oblique or left posterior oblique, the patient is in supine position. So pag sinabi nating right anterior oblique, the right side is close in contact to the tabletop. Na? The right anterior, mayroon tayong ruling na tinatawag dito sa obliques. So regardless whether it is RAO or LAO or RPO or LPO, mayroon tayong ruling dyan. Ano yung rules natin dyan sa obliques natin? The first part that name the oblique indicate the film side. I repeat, pag sinabi natin ano ang ruling natin pagdating sa obliques, wala tayong specific dito kung right anterior, left anterior, right posterior, or left posterior. Wala tayong specific na oblique dyan. Ibig sabihin, generally, pag sinabi nating oblique, yan, regardless whether that is LAO, RAO, RPO, or LPO, ang ruling natin, I repeat, the first part that name the oblique indicate the film side. And the second part that name the oblique indicate the tube side. For example, sinabi nating RAO, dito natin sa question. The first part that named the oblique, which is the anterior, diba? The first part that named the oblique, which is the anterior, like RAO natin, indicate the film side. Kaya nga ang sagot natin dito, the patient is rotated obliquely by elevation of the left side. Elevation of the left side. Dahil sabi nga natin sa RAO, the right side, the right anterior, indicate the film side. Right anterior, indicate the film side. So kung ang right anterior ay naka-close in contact sa film side, ang left side niya ay elevated. Ilang degrees ang elevation? That is 35 to 40 degrees. So the patient is rotated obliquely wherein the left side is elevated by 35 to 40 degrees. And the esophagus is centered to the level of T5 or T6. So yan ang reference point natin. So I repeat, balik tayo sa question, the right anterior oblique position of the esophagus, wherein the position of the patient is rotated obliquely. In other words, the right anterior is close in contact to the tabletop and the left side is elevated. So elevated. In other words, ilang degrees ang elevation? 35 to 40 degrees. And the reference point is T5 or T6. So that is the answer. Balikan natin ulit class sa ruling natin ng obliques. Ruling natin ng obliques. Pag RAO and LAO, RPO and LPO, generally yan ng oblique. The first part that named the oblique indicate the film side. And the second part that named the oblique, halimbawa, ang first part natin ay right anterior. Ano ang second part? The right posterior. So the right posterior indicate the tube side. Anyway, ako din naman ang magle-lecture sa inyo ng positioning. And sa face-to-face, I can discuss this clearly pagdating na sa face-to-face natin para at least mas makuha nyo. So the answer for number 1 is bravo. Next number. So balikan natin, sabi nga natin ito, bravo is the answer. Pag sinabi nating esophagus that is the third part of the alimentary tract or alimentary canal. So ang esophagus ay third part of the alimentary canal. And the esophagus is about how long is the esophagus? 10 inches long and 2 cm in diameter. So yan ang esophagus, that is the third part of the alimentary canal and about 10 inches long and 2 cm in diameter. Yan. Mamaya, may magtatanong ulit yan. Sir, pwede bang mahingi ang recorded video? Wag makulit ha. Ang recorded. Kaya hindi ko ito binibigay dahil meron tayong discussion sa face-to-face. Di ba? Para mas maintindihan. Ngayon, para mas maintindihan mo ng mabuti, isulat. No? Suplado si Mr. Rebelde sa personal. Dahil joke lang. Yan, hindi suplado. Minsan nakakairita kaya kayo, class. Pagkasasabi lang, mamaya tatanungin ulit. No? So, hindi ako magbibigay ng recorded video. Ito ay maa-access nyo pag at the end of our dynamic lecture. So anyway, itong dynamic, lahat naman kayo ay mag-face-to-face. Kahit na naka-face-to-face kayo, dahil nasa dynamic naman kayo, so makaka-access din kayo. No? So mas maganda ito kung merong discussion, yan isusulat nyo para mas naiintindihan at mas na-memorize nyo ng mas maaga. Okay? Esophagus, saan ang location ng esophagus? Esophagus is located posterior to the larynx and trachea. So ang esophagus ay posterior to the larynx and trachea, and the esophagus is anterior to the cervical and thoracic vertebral bodies. So ang esophagus, posterior siya ng larynx and trachea, and anterior siya to the cervical and thoracic vertebral bodies. So yan, dyan sa picture, makikita niyo. So the esophagus, that is 2 to 3 inches inferior to the jugular notch. So ang esophagus ay 2 to 3 inches inferior to the jugular notch. And in the esophagogram examination, the instructions given here is on expiration. Pag sinabi natin on expiration, that is on exhalation. So in other words, labas ang hangin, tigil. That is the instructions given on expiration. So in the esophagography or in the barium swallow, we usually use thin barium. Thin barium ang ginagamit natin for complete filling of the esophagus. Yon, thin barium for complete filling of the esophagus. And the esophagus can be seen also between the vertebra and the heart. So ibig sabihin, normally class, di ba, doon sa mga nag-interns, ang barium swallow or esophagogram, ginagawa natin yan pag ang request ng examination ay upper GI series or upper gastrointestinal series. Pag yun ang request, normally ang doktor nagpe-perform muna ng barium swallow ng examination of the esophagus bago magtuloy sa upper gastrointestinal series examination. So yan ang description ng esophagus. Anyway, mag-discussions naman natin dyan during the complete discussion of the barium swallow or esophagogram is on the face-to-face. Ako din na magle-lecture niyan ng procedure niya. Kasi pag hindi kayo pumasa sa radiographic procedures and techniques, magpapakamatay ako. Just lang. So lang, wag naman. Diba? Aral naman kayo. So ako ang tutulong, no? So, ibig sabihin, lahat ng lecture natin dapat lumabas sa board exam. Dahil kung hindi, patay tayo dyan. Kaya pakinggan ng mabuti, isulat din ng mabuti para magkaintindihan tayo. So, what are the pathologies in the esophagogram or in barium swallow? Ano ang mga nakikita natin? The indications, normally. Bakit kailangan mag-perform tayo ng esophagogram or barium swallow? Ano ba ang tinitingnan natin? What are the pathologic conditions? First, we have the achalasia. Pag sinabi natin achalasia, that is referring to the stricture or narrowing of the esophagus. So pag sinabi natin achalasia, that is referring to the stricture or narrowing of the esophagus. Isa yan sa mga pathologic condition na makikita pag nag-barium swallow or esophagogram. Another pathology that can be seen during barium swallow, we have the Barrett's esophagus. Pag sinabi nating Barrett's esophagus, that is referring to the stricture or strict appearance of distal esophagus. Or yan class, ha? Hindi yan stricture of. That is a stricture or strict appearance of the distal esophagus. So ang tawag niya ng condition na yon or ng pathology, Barrett's esophagus. And the Barrett's esophagus can be demonstrated in barium swallow. Another pathologic condition, we have the dysphagia. Kaya nga class ang barium swallow, kasama yan sa upper GI. Even in upper GI, di ba? Isa sa mga indications bakit kailangan i-perform ang upper GI because of dysphagia. Pag sinabi nating dysphagia, that is narrowing or enlargement of the esophagus. Or meron tayong definition dito that is referring to the, ano ba ang definition natin sa dysphagia? Difficulty of swallowing. Diba? Yan. Difficulty of swallowing, that is referring to dysphagia, or this is defined as the narrowing or enlargement of the esophagus. Yan. Another pathologic condition that can be demonstrated in barium swallow, we have esophageal varices. Esophageal varices. So when we say esophageal varices, that is referring to the narrowing and worm-like appearance of the esophagus. Esophageal varices, that is referring to the narrowing or worm-like appearance of esophagus. Another pathologic conditions that can be demonstrated in barium swallow, we have the Zenker's diverticulum. Zenker's diverticulum, that is referring to the enlarged recess or cavity in proximal esophagus. Enlarged recess or cavity in proximal esophagus. So these are the pathologic conditions that can be demonstrated in barium swallow. Class, do you have question? Any questions? We are now 254. So dito, meron dito ang mga cum laudes, 40. So yung 40 na cum laude, manya and summa, our expectations for you guys is to top the board exam. Bahala na kayo magsiksikan sa number 1 to 10. Basta lahat kayong 40 nandoon sa 1 to 10. Kaya ba? Uy, sagot. Cum laude, ha? Pag hindi ka nagtap, punyeta ka, pasasagasaan ko kayo sa highway. So those are the pathologic conditions of in the barium swallow. Okay, number 2 question. For a PA projection of the stomach, so examination of the stomach class, anong radiographic procedures yan? That is upper gastrointestinal series examination or upper GI series examination. Yan ang procedure natin for the demonstration of the stomach. So for the demonstration of the stomach, meron din tayong mga iba-ibang projections doon. So isa sa mga projections na ginagamit natin ay PA projection of the stomach. So in PA projection of the stomach, yan would be answer. Center, the reference point is midway between the xiphoid process and the umbilicus. Yan ang ating, that is our reference point for the PA projection of the stomach. So PA projection of the stomach. First, yan, ano ang reference point? That is midway between, ano ulit yun? Midway between the xiphoid process and the umbilicus. So pag sinabi nating midway between the xiphoid process and the umbilicus, that is at the level of L2 for the recumbent position. So in other words, kung ang pasyente naka-recumbent, pag sinabi nating recumbent position, in other words, the patient is lying in the table, X-ray table. Pag sinabi nating recumbent, nakahiga yun, wherein the central ray is perpendicular or vertically directed. So I repeat, pag sinabi nating recumbent, the patient is lying on the table wherein the central ray is perpendicular. Kung sa PA projection, naka-recumbent ang pasyente, ang reference point natin sa PA projection for the demonstration of the stomach is at the level of L2. For the upright possession, kung ang pasyente naman ay upright, pag sinabi nating upright, that is where the patient is in standing or erect possession. Hindi yan sitting. Pag sinabi nating upright for the demonstration of the stomach, the patient could either be in standing or in erect possession. Ano naman ang reference point natin? Kung ang pasyente ay naka-upright demonstrating the stomach, our reference point is 3 to 6 inches lower, lower or below the L2. So kung ang pasyente ay naka-upright possession, ang ating reference point sa PA projection for the demonstration of the stomach should be 3 to 6 inches below the L2, or 3 to 6 inches lower. Kung ang pasyente natin ay sthenic type of patient or body habitus, so ito yung mga sthenic, asthenic, hypersthenic, and hyposthenic are the type of body habitus. So, and these can be discussed properly during your face-to-face. Pag sinabi ko ang pasyente ay sthenic type, our reference point is at the level of the pylorus and duodenal valve. That is the level of L1. So kung ang pasyente ay sthenic type of body habitus, ang ating reference point ay level of the pylorus and the duodenal valve, that is the level of L1. So pag sthenic type ang body habitus, PA projection for the demonstration of the stomach, our reference point is pylorus and duodenal valve, that is the level of L1. Kung ang pasyente naman ay asthenic type of body habitus, our reference point is 2 cm below the level of L1. Kung ang pasyente natin ay asthenic type of body habitus, I repeat, our reference point is 2 cm below the level of L1. Kung ang pasyente naman natin ay hypersthenic type of body habitus, our reference point is 2 cm above the level of L1, which is nearer the midline. I repeat, kung ang pasyente ay hypersthenic and we want to perform the PA projection to demonstrate the stomach, our reference point is 2 cm above the level of L1 near the midline. So yan ang ating mga reference point with the different types of body habitus. Kung ang pasyente naman ay naka-upright PA possession, itong pinag-uusapan natin class ay PA recumbent for the demonstration of the stomach. Kung ang pasyente naman ay naka-upright, PA upright, PA upright to demonstrate the stomach. So ano ang purpose? Ano ang dine-demonstrate natin? PA upright possession in order to demonstrate the relative possession of the stomach, the size and shape of the stomach as well. The size and shape of the stomach can be demonstrated. I repeat, in upright PA, in upper GI, ang dine-demonstrate natin dito is the relative possession of the stomach, the size, and the shape as well. So in the recumbent, PA recumbent, aside for the demonstration of the stomach, the contour of the barium-filled stomach, and the duodenal valve can be demonstrated. Sa PA recumbent possession, this is also used to demonstrate the contour of the barium-filled stomach and the duodenal valve. So that is PA projection. Third question for the LPO and RPO possessions of the colon. So pag sinabi natin LPO and RPO possession of the colon, this is the projections which can be used for the demonstration of the large intestine. So when we say colon, that is referring to the large intestine. So in the barium enema examination, meron din tayong dalawang projections na ginagamit, the LPO and the RPO. LPO and the RPO. So what is the reference point here for the LPO and RPO? So for the LPO and RPO, the patient is supine dahil sabi nga natin kanina, pag sinabi nating right anterior oblique or pag sinabi nating anterior oblique, the patient is prone. Pag sinabi nating posterior oblique like LPO and RPO, that is known as AP oblique or that is known as posterior oblique. Pag sinabi nating class LPO and RPO, that is known as posterior oblique or that is also known as AP oblique. So dito for the demonstration of the large intestine or the colon, the patient is in supine position and the body is rotated by 35 to 45 degrees. The body is rotated by 35 to 45 degrees. Yan. 35 to 45 degrees. And the central ray, that is at the level of the iliac crest. From the AP with the central ray at the level of the iliac crest. So the answer here is letter C for the number 3. So pag sinabi nating LPO, ano ang dinedemonstrate natin? The right colic and the ascending and rectosigmoid portion should be open. So kung ang pasyente ay naka-LPO, that is where the left posterior part of the body is close in contact. Yon, the left posterior part of the body is close in contact to the tabletop and the right side is elevated. Now, ilang degrees ang elevation ng right side? 35 to 45 degrees body elevation. So pag naka-LPO, ang right colic and the ascending and the rectosigmoid portion should be open. Pag naka-RPO naman, that is the same process. The body is rotated or the right posterior part of the body is close in contact to the tabletop and the left side is elevated. Ano ang dinedemonstrate natin dito? The left colic and the descending portions of the colon should appear open in the RPO. So pag LPO, the right colic, pag sinabi nating right colic, that is referring to hepatic flexure. Pag sinabi nating left colic, that is also referring to the splenic flexure. So pag naka-RPO ang pasyente, the left colic or the splenic flexure and the descending portions of the colon should appear open. So in the RPO, if the rectal ampulla is included, then the central ray is 2 to 3 inches higher. 2 to 3 inches higher. So in other words, ano ito? Central ray or the image receptor is 2 to 3 inches higher. Ibig sabihin, kung rectal ampulla is included, the image receptor is 2 to 3 inches higher. Yan. So mayroon tayong factors na ginagamit dito for the demonstration of the colon. Kung single study, pag sinabi nating class single study, that is only using barium sulfate. Yeah? So pag dito kasi sa barium enema, meron tayong dalawang klase ng examination or 2 phases of examination. One, we have the single contrast by using only the contrast medium and the double contrast by using the barium sulfate and air. Yan, ito naman yung double contrast. So may factors tayong ginagamit. Pag single contrast study, only ang ginamit natin. So the technical factor that we are going to use is between 100 to 125 kilovolts or kilovoltage. So yan ang ginagamit natin na factors pag single contrast study. Pag double contrast, syempre bababaan natin ang factor. No? Pag double contrast, that is using barium sulfate and air, that is 90 to 100 kilovoltage ang factor na ginagamit natin. Kung ang contrast medium na ginamit natin ay iodinated water-soluble or water-soluble iodinated contrast medium, our technical factor na gagamitin ay 80 to 90 kilovoltage. So magkakaiba ang factors na ginagamit natin, both in upper GI as well as in barium examination. So magkakaiba ang factors. Kung single contrast study or using barium sulfate only, 100 to 125 kilovoltage. Kung double contrast, in other words, using barium sulfate and air, 90 to 100 kilovoltage. Kung water-soluble iodinated contrast medium ang gagamitin natin, And the kilovoltage na gagamitin is 80 to 90 kilovoltage. So yan ang factors na gagamitin. Take note yan na class, dahil baka hindi na natin masama yan sa discussions. Makalimutan ko, at least dito nasabi na natin. Okay, number 4. For a lateral decubitus, possession of the colon. Lateral decubitus, possession of the colon. Wait lang. Okay, for the number 4, for a lateral decubitus, possession of the colon. So dito sa barium enema, gumagamit tayo ng dalawang lateral decubitus tayo dyan na ginagamit. Kailan natin ginagamit ang lateral decubitus? Meron tayong left lateral decubitus at meron tayong right lateral decubitus. Ginagamit natin during double contrast examination. Wala tayong lateral decubitus na ginagamit class sa single contrast, ha? Ang ating decubitus, ginagamit natin yan during double contrast examination. So in the lateral decubitus possession of the colon, decubitus of the colon, the patient is lying on one side and the image receptor is centered to the iliac crest as our reference point, and the central ray is horizontally directed at the level of the iliac crest, di ba? Dahil sabi nga natin, class, ano ba ang difference ulit ng sinasabi natin na lateral decubitus sa difference between decubitus and recumbent? So pag sinabi nating decubitus, in other words, that is where the patient is lying on either side of the body or on one side of the body, either left or right, wherein the central ray is horizontally directed. Decubitus yun. I repeat, pag sinabi nating decubitus, that is where, pag sinabi nating decubitus, that is lying on one side, wherein the central ray is horizontally directed. Pag sinabi natin recumbent, that is where the patient is lying on either side, wherein the central ray is perpendicular or vertically directed. Kailan natin ginagamit ang lateral decubitus sa barium enema? During the double contrast examination. Okay, pag sinabi nating right lateral decubitus, wherein the right side is lying on the tabletop. Diba? Pag sinabi nating right lateral decubitus, that is where the right side is lying on the tabletop. And the medial side of the ascending colon can be demonstrated. The medial side of the ascending colon can be demonstrated, and the lateral side of the descending colon can also be demonstrated. Ito yung nasa itaas, no? So in other words, the right lateral decubitus, the right side, is lying or close in contact to the tabletop. Ang dinidemonstrate natin yung nasa itaas, the medial side of the ascending colon and the lateral side of the descending colon can be demonstrated. So ano pa ang dine-demonstrate natin sa right lateral decubitus? The polyps of the left side can be demonstrated. The polyps of the left side can be demonstrated. Yan, in the right lateral decubitus. And on the left lateral decubitus, pag sinabi nating left lateral decubitus, the left side is lying, or in other words, the left side is close in contact to the tabletop. And the medial side of the descending colon and the lateral side of the ascending colon can be demonstrated. So the medial side of the descending and the lateral side of the ascending up, yung dito sa itaas. Yun ang dito-demonstrate natin. So in the left lateral decubitus, the polyps on the right side can be demonstrated also. The polyps on the right side can also be demonstrated. So ito yung gamit natin ng right and left lateral decubitus. I repeat, kailan ginagawa ang lateral decubitus? During double contrast study examination. Okay, do you have any questions, class? Class, tanong, meron bang hindi naintindihan para maulit natin? Mabagal ba ako o mabilis ba ako? Plus, nandyan pa kayo.
Yes po.
Ayun. Walang tanong. Naintindihan ba, class? Naintindihan kahit naka-raise lang yung hand. Yan. Para naman, parang feeling ko wala akong kausap parang walang nagsasalita. Ano ba yan?
Sir.
Yan. Yun. Olivia
Sir,
Vivar. Salamat. Otto Kit. Yan. Mahirap mag-lecture nung hindi ko na nakikita. Parang ano. Yan. So, thank you very much. Next question, number 5. Which examination can be performed on a non-gravid patient? Yan. So, meron tayo class projections or meron tayo mga examinations na ginagawa pag sinabi nating non-gravid patient, yung mga hindi buntis na pasyente. No? Ano ba itong piniperform natin? Which examinations that we are going to perform from a non-gravid patient? Yan. Pag sinabi nating non-gravid patient, yan yung mga hindi buntis. No? What are the examination or which examination can be performed on a non-gravid patient? So the answer here is hysterosalpingography. So isa yan sa mga procedure. Ano ba ang mga procedure natin ng non-gravid? We have hysterosalpingography, we have pelvic pneumography, and we have vaginography. So these are the non-gravid procedures. Okay? So ito class ang mga non-gravid procedures. We have the hysterosalpingography, we have pelvic pneumography, we have vaginography. Pag sinabi naman nating hysterosalpingography, which is the matatakel natin during discussions, determine the size, the shape, and position of the uterus and the uterine tubes. Pag sinabi nating hysterosalpingography, this is used to determine the size, the shape, and position of the uterus and the uterine tubes. Yan. O, i-remind ko lang class, ha? Isulat lahat ng sinasabi ko. Dahil lahat ng sinasabi ko, tinatanong sa board exam yan. Ha? Para pagdating na natin sa face-to-face, hindi na tayo mahirap balikan ulit sa mga discussions natin. Ha? Lahat ng sinasabi ko, tinatanong sa board exam yan. Kaya isulat, tandaan, at memoryahin. Ha? So mayroon pa ditong naka-join sa atin yung mga nag-start ng dynamic noong February. So instead na matatapos na kayo, additional ulit ito sa inyo. So this is advantage on your part. Yung mga first dynamic natin na nag-start ng February. Mayroon isa dyan, nagsusumbong sa din niya na lagi daw walang klase. May klase naman tayo. So ito nga, may additional ka pa, di ba? Magreklamo. Bawal magreklamo. Ang mga estudyante na magte-take ng board exam, yan ang mga estudyante na mababait sa balat ng lupa. Yan dapat. Kasi pag hindi ka mabait, karma is digital. Parang RADTECH lang yan eh. Ang karma digital yan. Diba? So, wag magreklamo. Dahil nag-uumpisa pa lang tayo, nagreklamo agad. No? So, ito, advantage nyo ito, yung mga nag-start ng dynamic ng February. Dahil parang nag-ulit ka ulit ng dynamic mo this time. No? Instead na dapat tapos na kayo. Okay? So, hysterosalpingography. I repeat, to determine the size, the shape, and position of the uterus and the uterine tube. So for pelvic pneumography as one of the procedures for non-gravid patient, ano ang purpose nito? To evaluate the pelvic cavity. Evaluation of the pelvic cavity. That is pelvic pneumography. Another non-gravid patient or non-gravid procedure, we have the vaginography. Pag sinabi nating vaginography, that is referring to a congenital abnormalities, vaginal fistulas, and other pathology of the vagina. So yan ang dine-demonstrate natin sa vaginography. Congenital abnormalities, vaginal fistulas, and other pathology of the vagina. So ito lang ang tatlong procedure for non-gravid patient. Hysterosalpingography, pelvic pneumography, and vaginography. For the gravid patient naman, so pag sinabi nating gravid, ito yung mga nabubuntis, no? Mga buntis. Ano yung mga procedure natin of gravid procedures? We have the fetography, we have pelvimetry, we have fetal cephalometry, and placentography. So these are the gravid patient, or these are the gravid procedures. Fetography, pelvimetry, fetal cephalometry, and placentography for the gravid patient. Okay? So alam nyo na ngayon ha, yung non-gravid, tatlo lang ang procedures natin dyan. We have hysterosalpingography, we have pelvic pneumography, and vaginography. For the gravid procedures, we have fetography, pelvimetry, fetal cephalometry, and we have placentography. Number 6 question. Number 6 question, which part of the uterus is most superior? Which part of the uterus is most superior? And our answer here is fundus. Fundus, that is the most superior part of the uterus. The fundus, that is the superior or the most superior portion. The body, that is also known as corpus, that is where the entrance of the two uterine tubes. So the entrance of the two uterine tubes, that is the body, or that is known as corpus. Another part, we have the isthmus. The isthmus, that is known as the superior part of the cervix. So the superior part of the cervix, that is the isthmus, and the cervix, that is the neck or the vaginal end of the uterus. So the neck or the vaginal end of the uterus, that is the cervix. So those are the parts of the uterus. So yan ang parts natin ng uterus. Next number, we have number 7. So for the number 7, for RPO and LPO possessions of the kidneys. So sa intravenous urinogram or intravenous pyelography, meron din tayong dalawang oblique projections doon to demonstrate the kidneys. Meron tayong right posterior oblique and we have the left posterior oblique. So ang right posterior oblique, meron tayong timetable dyan. Meron tayong time interval dyan. Halimbawa, kung kumuha ka ng RPO, that is RPO 30 minutes. Ang LPO natin, that is 45 minutes time interval. So mayroon niyang time natin, no? Kung mauuna ang LPO mo, that is 30 minutes, and RPO mo is 45 minutes. So in other words, there is a time interval and the IVP for obliques for the demonstration. And so dito sa number 7, kung titingnan mo class, no, yung mga choices, nakakatamad basahin. Ang hirap, hindi ka sigurado kung alin ang tamang sagot mo dahil sa hahaba. No? So for the RPO and LPO possessions of the kidneys, the patient is supine, the body is rotated, the body is rotated by 30 degrees obliquely. The kidney farther from the image receptor is imaged parallel to the image receptor, and the kidney nearer to the image receptor is imaged perpendicular to the image receptor, and the central ray is perpendicular to the image receptor. Diba ang gulo? Diba? Magulo at hirap intindihin. So in other words, iiklian natin. No? Pag RPO and LPO, halimbawa naka-RPO tayo. Diba? Kung tayo ay naka-RPO, in other words, aling part dyan ang naka-close and contact? The right posterior. Alin dyan ang part na elevated? The left posterior. So, ibig sabihin, ilang degrees ba ang body rotation? 30 degrees. RPO tayo, ha? Ibig sabihin, ang left posterior ang naka-elevate. So, kung ang left posterior ang elevated, in other words, the left kidney is parallel to the image receptor. So, since na ang right posterior ang naka-close in contact sa table, the right kidney now is perpendicular to the tabletop, to the image receptor. Nakuha ba? I repeat, pag sinabi nating RPO, the right posterior eye close in contact and the left posterior is elevated. So kung ang left posterior ang elevated, in other words, the left kidney is parallel to the image receptor. So naka-RPO tayo, in other words, the right posterior is close in contact to the table, the right kidney is perpendicular to the image receptor. Naintindihan ba? So kung ano ang naka-close in contact, yun ang perpendicular. Kung ano ang elevated or remote, yan ang parallel to the image receptor. Nagkaintindihan ba tayo, class? Pag sinabi nating RPO and LPO for the demonstrations of the kidneys, the body is rotated by 30 degrees. So 30 degrees ang ating body rotation. The kidney remote from the film should be. So ang kidney na remotest from the film or ibig sabihin ng kidney na malayo sa plaka should be demonstrated in profile. No? So kung ano ang kidney, pag sinabi nating kidney remote, in other words, sa other term ng remote, elevated or farthest from the film should be demonstrated in profile. And so RPO and LPO, the central ray is at the level of the iliac crest. So the central ray is at the level of the iliac crest. That is LPO and RPO. Next number 8. When should a hysterosalpingographic examination be performed? Hysterosalpingographic examination be performed. Kailan piniperform ang hysterosalpingography? Hysterosalpingography can be performed 10 days after the onset of menstruation. Hysterosalpingography examination can be performed 10 days after the onset of menstruation. When we say hysterosalpingography ulit, balikan ulit natin, that is a radiographic examination demonstrating the female reproductive tract using contrast medium. So that is used to demonstrate, or a radiographic examination demonstrating the female reproductive tract using contrast medium. So ano ang dine-demonstrate natin? The size, the shape, and position of the uterus and the uterine tubes. Di ba? Yan ang female reproductive tract. Ayan ang female reproductive tract. So the purpose of hysterosalpingography, I repeat, that is used to demonstrate the size, the shape, and position of the uterus and the uterine tubes. And this is demonstrating the uterine cavity and the patency of the uterine tubes. So ano ba yung mga indications? Kailan natin ginagawa ang hysterosalpingography? Hysterosalpingography can be demonstrated when there is an infertility assessment. So if you are going to assess the infertility sa female patient, babae lang ang ginagawa ng hysterosalpingography. Ano na ang sa lalaki? Vesiculography. So ang sa lalaki naman, vesiculography naman to demonstrate the infertility. So to assess the infertility for male, vesiculography ang procedure natin. For female, hysterosalpingography. Another indications, bakit ginagawa ang hysterosalpingography aside for the assessment of infertility, the functional and structural defects. Functional and structural defects can also be used to perform in hysterosalpingography. And aside for that, evaluation of the uterine tube after tubal ligation. To evaluate also the uterine tube after tubal ligation. So ibig sabihin, kung nagpaligate na ang babae, hindi na siya manganganak, yan. Pwede siya mag-undergo ng hysterosalpingography to evaluate the uterine tube. Dahil baka makalusot na. Baka makalusot pa ulit. Dahil ligated na pero nagbuntis pa, yan. So minsan nagtataka bakit siya nagbuntis, ligated na naman. Diba? So after the tubal ligation, the patient could be under a hysterosalpingography in order to evaluate the uterine tube. So yun ang mga indications. And the in-depth discussion of hysterosalpingography during our face-to-face discussion. Next question, number 9. Which type of contrast medium is preferred for hysterosalpingography? Ano ba ang ginagamit natin na contrast medium? Dito. So the answer, that is water-soluble iodinated contrast medium. So water-soluble iodinated contrast medium, yan ang contrast medium na gagamitin natin sa hysterosalpingography. So water-soluble, meron kasi dalawang klase ng contrast medium na ginagamit. Yung luma na contrast medium ay oil-based contrast medium. Na? Oil-based yun, that is the past contrast medium used in hysterosalpingography, the oil-based contrast medium. Bakit oil-based? Bakit pinalitan? Because it has a low absorption rate and persists in the body cavities for an yan, oil-based, absorption rate, and persist in the body cavities for an extended time. Yan. So, ibig sabihin, low absorption rate at saka tumatagal, sumusobra sa oras doon sa body cavities, ang oil-based contrast medium. Kaya pinalitan. Ano na ang ginagamit natin ngayon sa water-soluble, sa hysterosalpingography? We have the water-soluble iodinated contrast medium. Bakit pinalitan ng water-soluble iodinated? Because it absorbed easily by the patient. Second, it does not leave a residue within the reproductive tract. And third reason, provides adequate visualization. So yan ang reason. Bakit? So bakit pinalitan? Ang lumang ginagamit natin na contrast medium ay oil-based contrast medium. Pinalitan dahil mababa ang absorption rate at nag-i-extend ng time doon sa body cavities. Whereas at present, or the current contrast medium used for the hysterosalpingography is the water-soluble iodinated contrast medium for the 3 reasons. Una, it absorbed easily by the patient. Pangalawa, it does not leave a residue within the reproductive tract, and it provides adequate visualization. So yan ang reason bakit naging water-soluble iodinated contrast medium na ang ginagamit. Gaano karami ang ginagamit na water-soluble iodinated contrast medium? 5 ml. Yan ang ginagamit to fill the uterine tube. And additional 5 ml to demonstrate the uterine tube patency. So to fill the uterine tube, we used 5 ml of the water-soluble iodinated contrast medium and additional 5 ml if we are going to demonstrate the uterine tube patency. So yan. So 10 ml all in all ang ginagamit natin sa hysterosalpingography. Class, call of nature. Hihilang sandali. A break muna, 5 minutes. Okay, let us now continue. Next question, number 10. At which vertebral level is the superior border of the kidneys usually found? So, anong level? That is at the level of T12. So, the vertebral level or the superior border of the kidneys is usually at the level of T12. Yan. So, puntahan muna natin sa kidney, no? Kung makikita mo ang kidney, no, that is 150 grams. And that measures 4 to 5 inches or 10 to 12 cm long. And that is 2 to 3 inches wide. Yan. So, kung yung haba na yan ng kidney, yan, that is 4 to 5 inches. So, yung lapad niyan ay 2 to 3 inches. The left kidney is a little longer but narrow than the right side. So, kung titingnan mo, class, dyan sa picture natin, no? Ang left kidney dyan, yan ang nasa right side mo, no? Yan ang nasa right, yan ang left. So, itong nasa left, nasa gitna, yan ang right kidney. So, the left kidney is 1 cm superior than the right side. Kaya kung makikita mo dyan sa picture na ang right kidney ay mas mataas ng 1 cm dito sa right kidney, no? So the top of the left kidney is at the level of T12, T11 and T12. So yan ang top, no? The top or the superior border of the left kidney is at the level of T11 to T12. And the bottom of the right kidney is at the level of the superior part of L3. Yan. So yung bottom, itong nasa gitna na kidney, class, no? Yung the right kidney or the bottom of the right kidney is at the level of the superior part of L3. So yan, kung makikita mo yung mataas na kidney, yan ang left kidney, no? Dahil ang left kidney ay higher by 1 cm than the right kidney. Number 11, which of the following is an excretory examination used to demonstrate the upper urinary tract? So which of the following is an excretory examination used to demonstrate the upper urinary tract? And the answer, we have the intravenous urography. Intravenous urography. So pag sinabi nating excretory, urogram, that is also known as intravenous urography. Now, pag sinabi natin excretory urogram, that is also known as IVU or intravenous urography. That is a radiographic examination of the urinary system. Now, excretory urography is a radiographic examination of the urinary system. Pag sinabi nating IVP, yan ang old term na ginagamit natin, no? That is referring or the radiographic examinations of the renal pelvis alone. No? So pag sinabi nating IVP or intravenous pyelography, that is a radiographic examination of the renal pelvis alone. No? Kaya pag sinabi natin excretory urogram or intravenous urography, yan ang examination of the urinary system. So pag sinabi nating examination of the urinary system, that includes visualizing the minor and major calyces, the renal pelvis, the ureters, the urinary bladder, and the urinary bladder. So yan ang dine-demonstrate natin, the urinary system, the entirety of the urinary system. I repeat, pag sinabi nating intravenous urogram, that is also known as excretory urography. That is a radiographic examination of the urinary system, which visualizes the minor and the major calyces, the renal pelvis, the ureters, and the urinary bladder. So pag sinabi natin excretory urography or intravenous urography, this is a true functional test because the contrast medium is rapidly removed from the bloodstream and excreted completely by the kidney. Removed from the bloodstream and excreted completely by the kidney. So, in other words, pag sinabi nating excretory urography or intravenous urography, this is a true functional test. Dahil bakit tinawag na true functional test? Because the contrast medium is rapidly removed from the bloodstream and excreted completely by the kidney. Yan. Pag sinabi naman nating retrograde urography, saan piniperform ito? Pwedeng i-perform ito sa X-ray department or in the operating room. And this is for the examination of the pelvic calycial system. Retrograde urography from the word retro, in other words, that is against the flow. Introduction of the contrast medium, which is introduced directly into the pelvic calycial system. Now, pag sinabing word na retro, in other words, against the flow. Retrograde urography, that is the non-functional examination of the urinary system. Non-functional examination of the urinary system, that is retrograde urography. That is where the contrast medium is being introduced directly into the pelvic calycial system. So retrograde urography. Pag sinabi naman nating retrograde cystography, that is also a non-functional examination of the urinary system to rule out. Ano ang niro-rule out natin dito sa retrograde cystography? Retrograde cystography to rule out the trauma, calculi, or the stone, the tumor, and inflammatory disease. Yan. So yan ang niro-rule out natin. Retrograde cystography, I repeat, that is a non-functional examination of the urinary system to rule out trauma, tumor, calculi, and inflammatory disease. And another procedure, we have the cystourethropy. Cystourethropy, that is a functional study of the bladder and the urethra. So pag sinabi nating cystourethropy, that is a functional study of the bladder and the urethra. So ano ang dinidemonstrate? Ano ang purpose natin dito sa cystourethropy? For the demonstration of trauma and incontinence. So pag sinabi nating incontinence, in other words, ito yung tinatawag natin na balisawsaw. No? So for the demonstration for possible trauma and incontinence, the procedure na ginagawa natin ay cystourethropy. Okay, do you have questions? Next question, which examination has the ability to produce a radiographic image demonstrating renal cortical tissue well saturated with contrast medium? So kung papansinin mo, magkaiba ang tanong pero the same ang choices nila. No? Which examination has the ability to produce a radiographic image demonstrating the renal cortical tissue well saturated with contrast medium? Excuse me, the answer is the same. Dahil sinasabi natin word renal, so that is intravenous urography. So for the number 12, the intravenous urography. Number 13. Which projection best demonstrates the mobility of the kidneys? So pag narinig class yung word na mobility of the kidneys, walang ibang posisyon ang nagde-demonstrate ng mobility of any organ except upright position. Upright, erect, or standing position. So pag mayroong word na mobility, isa lang ang titingnan mo sa choices. Either upright, standing, or erect position. And that is the best, no? That is the best projection demonstrating the kidneys. So AP projection with the patient in upright position. So that is AP erect. So pag sinabi nating AP erect, or that is AP upright, or AP standing position, and this is also the position which is used to outline the lower ureters and the urinary bladder. So the well demonstration of the lower ureters and the urinary bladder can be demonstrated wherein the patient is AP erect, or AP upright, or AP standing position. Next, number 14. The intravenous or intravenous urography. What is the purpose of applying compression pads over the distal ends of both ureters? The intravenous urography, what is the purpose of applying compression pads over the distal ends of both ureters? So dito sa IVU or sa IVP or sa excretory urography, gumagamit tayo dito ng compression pads. Ano yung example ng compression pads? Yan. So if you can see, that is the compression pads dyan sa picture na yan. Ano ang purpose ng compression pads? Yan, to inhibit the flow of urine into the bladder and to distend the renal pelvis and calyces. Yan. So dapat ang compression device should be centered at the level of the ascis. And at the level of the ascis, ano nga ang purpose natin ng compression pads? To retard the flow of opacified urine into the bladder. To retard the flow of opacified urine into the bladder. So retard, in other words, inhibits the flow of urine into the bladder. So yan, babagalan lang na para ma-distend ang pelvis at ang calyces. So itong compression bands natin na kinakabit, the compression band is applied over the distal end of the ureters. So the compression pads is applied over the distal ends of the ureters. And also the other purpose of these compression pads ensures adequate filling of the renal pelvis and calyces. And to ensure adequate filling of the renal pelvis and calyces, isa yan sa purpose ng compression pads. And another purpose, it allows the renal collecting system to retain the contrast medium longer for a more complete study. So yan ang purpose natin. No? That is the compression of using the compression pads. Yan. So I repeat, ang compression pads ay ina-apply over the distal ends of the ureters. No? Applied over the distal ends of the ureters. And the other reasons is to retard the flow into the bladder. So pag sinabi natin retard the flow, inhibits the flow into the urine or of urine into the urinary bladder. So, bakit kailangan ma-retard or ma-inhibits ang flow? So that the renal pelvis and the calyces will be distended, para ma-distend. No? And so that is the reason of the compression pads and the IVU. Next number 15. Yan, for number 15 question, which of the following is not a reason for obtaining a scout radiograph with the patient recumbent for excretory urography? Alin daw dito, no? Which of the following is not a reason for obtaining a scout film? Ano ba ang primary purpose natin ng scout film? Una, to evaluate what are the exposure factors that we are using. Another purpose ng scout, pag sinabi nating scout film class, that is preliminary film yan, no? Pag sinabing scout radiography, that is preliminary film. Ano, bakit kailangan natin kumuha ng scout film? I repeat, yan. Isa, to evaluate the exposure factors. Anong gagamitin? To demonstrate kung mayroon bang urinary calculi. And also to determine the location of the kidneys. Yan. Location of the kidneys. And to verify positioning. No? Or to verify when the patient is properly prepared or not. So yun ang mga reasons natin, no? Sa scout film. Verify the patient preparation, determine the exposure factors, verify the patient positioning, to detect and abnormal calcifications, as well as to demonstrate the location of the kidneys. So ano lang dito ang hindi kasama? To demonstrate the mobility of the kidneys. Dahil ang scout film to demonstrate the mobility of the kidneys, that can be demonstrated in upright position. Yeah? So yan lang ang hindi. No? Yan lang ang hindi reason dito sa scout film. Next, number 16. The excretory urography. What should an adult patient do just before getting on the examination table? So dito sa IVU natin, pag meron tayong IVU na pasyente, anong instructions ang binibigay natin sa pasyente? We instruct the patient to empty the bladder muna before getting on the examination table. Bago natin pasakayin sa table, X-ray table, we instruct the patient to empty first the bladder. And so instruct the patient to empty the bladder completely. Ano ang reason bakit kailangan empty ang bladder before the IVU? To prevent dilution of the opacified urine when it enters the bladder. So yan ang purpose, no? Bakit or in IVU or in excretory urography or intravenous urography, we usually instruct the patient to completely empty the bladder. Ano ang reason? To prevent dilution of the opacified urine before or when it enters the bladder. Yun ang reason, no? Para hindi mag-dilute ang contrast medium doon sa urine bago pumasok doon sa urinary bladder. Kaya dapat completely empty ang bladder sa excretory urography or intravenous urography. Next question, number 17. Question number 17, for a small bowel series, of a patient with hypomotility of the small intestine, which procedure should be performed to accelerate the peristalsis? So sa small bowel series examination, meron tayong 4 na klaseng procedures na ginagamit, di ba? Isa, wherein through the mouth, the contrast medium is being introduced through the mouth. Isa ay meron tayong complete reflux. At isa, we have the intubation method. And meron tayong, ano pa isang procedure natin? So meron tayong 4 na procedures dito sa small bowel series examination. Yan. So in small bowel series examination, procedure should be performed to accelerate the peristalsis. The patient should be instructed to drink a glass of ice water. So para bumilis, no? Para mag-accelerate yung movement or yung peristalsis, the patient should be instructed to drink a glass of ice water. Yan, para mag-accelerate ang peristalsis. So, or aside from giving a glass of ice water, a food stimulant after 3 or 4 hours. Yan, to accelerate the peristalsis. So yan, to accelerate peristalsis, food stimulant. So ano yung mga food stimulants? Like for example, food stimulant, water-soluble, gastrointestinal contrast medium should be given. Ano pa yung other food stimulant? The tea, coffee. So these are the drinks that is referring to food stimulant. Yan, binibigay para mag-accelerate yung peristalsis. So the patient should be given a glass of ice water, pwedeng bigyan ng tea, pwedeng bigyan ng coffee, or the water-soluble gastrointestinal contrast medium should be given to accelerate the peristalsis. And the examination for the small bowel examination should be completely in 30 to 60 minutes. So dito sa small bowel examination, I repeat, the examination, ito lang ang mayroong procedure. Ito lang ang procedure na mayroong interval or time interval, no, sa small bowel examination, especially for when the contrast medium is being given through the mouth. So kung ang contrast medium ay binibigay through the mouth, mayroong time interval tayo dyan. Ano yung first projection natin sa small bowel examination wherein the contrast medium is being given orally or through the mouth? First projection is 15 minutes. The second is 30 minutes. The third, 15, 30, 45, and 60 minutes. So yan ang time interval natin sa small bowel examination. Okay, next question. Next question. What is the purpose of obtaining an AP projection radiograph of the kidneys 30 seconds after the bolus injection of a contrast medium in excretory urography? Yan, what is the purpose of obtaining an AP projection radiograph of the kidneys 30 seconds after giving the bolus injection of a contrast medium in excretory urography? Yan, the answer here, to demonstrate the opacified renal arteries. So dahil excretory urography, yan, renal arteries tayo sa. Next, number 19. How many degrees should the patient be rotated? How many degrees should the patient be rotated for AP oblique projections, posterior oblique possessions during excretory urography? So kung natandaan mo itong question natin kanina sa number 1, di ba? Or rather, number 4 yata, na questions natin. How many degrees should the patient be rotated for an AP oblique projection, posterior oblique, or RPO na tinatawag natin? So that is 30 degrees. Diba? In RPO, the body is rotated by 30 degrees. Yeah, next number 20, for intravenous urography, a child. What should the patient be given when the scout radiograph shows an excessive amount of intestinal gas overlying the kidneys? So pag nag-IVU daw tayo sa bata, then nakita sa scout film na mayroong excessive amount of gas overlying the kidneys. Ano ang binibigay natin before the procedure? The patient should be given first at 12 ounces of any carbonated soft drinks. So kung nakita sa scout film na mayroong excessive amount of intestinal gas overlying the kidneys, especially for a child, the patient should be given at 12 ounces of any carbonated soft drinks. So binibigyan ng 12 ounces na carbonated soft drinks. Ano yung mga carbonated soft drinks? 7-Up, yan, Mountain Dew, para dumighay ang pasyente. So pwedeng bigyan ng 12 ounces or carbonated soft drinks. Yan, pwede rin bigyan, the gas-containing loops are usually pushed. Yan. The gas-containing loops are usually pushed inferiorly and upper urinary tracts. So, pag newborn, the patient should be given 2 ounces. Yan, 2 ounces ng carbonated soft drinks. 12 ounces for a child, 7 to 8 years of age. Yan. So ito yung binibigay natin na carbonated gas-producing substance. Now for newborn, 2 ounces are required. For 7 to 8 years old child, 12 ounces are required in order to demonstrate when there is an excessive amount of intestinal gas. Okay, next number 21. Which condition would most likely be demonstrated during voiding cystography? So pag sinabi natin voiding cystography, ito yung tinatawag natin na VCUG. No? Voiding cystourethropy. Yan. Voiding cystourethropy. So ang ating condition most likely to be demonstrated during urination or during voiding cystourethropy ay ureteral reflux. No? The condition during anong dinidemonstrate? Ureteral reflux yan, class. No? 21, ureteral reflux. Yan. Ureteral reflux ang dinidemonstrate natin. So, this voiding cystography, ano pang dinidemonstrate natin aside for the demonstration of the ureteral reflux? It is also used to delineate the urethral canal. No? So dalawa ang dine-demonstrate natin, to demonstrate the urethral canal and also to demonstrate or to delineate the urethral canal and urethral reflux. So yung letter C, class, urethral reflux yan. No? So for the number 21. Pag sinabi nating delineation, that is also known as demonstration. Next number 22. Number 22, for the AP axial projection of the bladder, how many degrees and in which direction should the central ray be directed? For the AP axial projection of the bladder, how many degrees? How many degrees and in which direction should the central ray be directed? So the answer is 15 degrees caudal. The answer is 15 degrees caudal. Normally, class, yan dito, that is 10 to 15 degrees caudally ang ating central ray. Class, parang malakas ang ulan dyan sa inyo. Napakalakas ng ulan. Okay, so I repeat, number 22, our answer is 15 degrees caudally. Usually, this is 10 to 15 degrees caudally to project the symphysis pubis below the urinary bladder. So kaya nag-a-angle tayo ng 10 to 15 degrees caudally so that the symphysis pubis will inferior to the bladder. So I repeat, ang dine-demonstrate din natin dito sa AP axial projection of the bladder is to demonstrate the urinary reflux. So urinary reflux ang dine-demonstrate natin. So ang central ray natin sa APH or projection of the urinary bladder, that is 10 to 50 degrees caudal. Yan, kaya lang wala naman dyan nakalagay na 10. So our answer is 15 degrees caudally. Ano ang reason bakit tayo nag-angle ng 15 degrees caudally? To project the symphysis pubis below the urinary bladder. Yan, so yan ang answer natin. And that is used to demonstrate the urinary reflux. Next number 23. Number 23, which examination of the alimentary canal requires that a series of radiographs be taken at specific time intervals after the ingestion of the contrast medium? Which examination of the alimentary canal requires that a series of radiographs be taken at a specific time intervals after the ingestion of the contrast medium? So when we say ingestion of the contrast medium, that is where the contrast medium is being taken orally, no? Through the mouth. Pag sinabi nating ingestion. Alin daw dito ang examination ng alimentary canal that requires a series of radiographs be taken a specific time interval. So sabi ko nga kanina, ng discussions natin sa nauna, ang small intestinal series ay mayroong time interval yan after ingestion of the contrast medium. So sabi nga natin, the first exposure, we have 15 minutes. The second is 30 minutes. The third is 45 minutes. And the last exposure is 60 minutes. So ito lang ang mayroong procedure, examination at the alimentary canal that requires a time interval after ingestion of the contrast medium. Small bowel series examination na. So pag sinabi nating small bowel series examination, that is also known as a follow-through examination. Small bowel series examination or a follow-through examination. Yan lang ang may time interval after ingestion of the contrast medium. So ano ang time interval natin for the small series examination? We have the 15, 30, we have 45, and 1 hour or 60 minutes rather. Yeah, next number 24, wherein the large intestine is, where is the large intestine is the left colic flexure located. So saan daw ang left colic flexure located? Pag sinabi natin ulit na left colic flexure, that is referring to the splenic flexure. Saan daw makikita ang splenic flexure? Between the transverse colon and the descending portion of the colon. So doon makikita natin ang splenic or the left colic flexure. Left colic, that is between the transverse colon and the descending portion of the colon. Ang right colic naman or the hepatic flexure, saan naman siya makikita? That is between the transverse and the ascending portion of the colon. So ang left colic flexure or the splenic flexure can be located between the transverse colon and the descending portion. Ang right colic, yan, or the hepatic flexure can be seen between the transverse and the ascending portion of the colon. Doon naman makikita yan. Yan, for the number 25 question, what is the most common examination which requires the use of contrast media? So which is or what is the most common examination which does not requires the use of contrast media? So alin dito ang common examination na hindi ginagamitan natin ng contrast media? We have the chest PA examination. Diba? Tama ba? The most common. The most common that does not use. The most common, hindi. Mali itong question class. Hindi does not. What is the most common examination? Most common examination which requires the use of contrast media. Lahat ito. A, B, C, D, ginagamitan ito ng contrast media. So alin lang dito ang most common? Ang chest PA. Yan lang ang most common. Anong contrast media ang ginagamit ng chest PA? Ang ginagamit na contrast medium sa chest PA ay negative contrast medium. No? Negative contrast medium which is the air. Yan. Ito ang most common. What is the most common examination which requires the use of contrast media. Yan, chest PA is our answer. Richard, ano ito? Bakit may line? Okay, so do you have any questions, class? Questions? Baka meron kayong questions. So break tayo ng maaga and we will start at 12:45. Okay lang ba, class? Magbe-break tayo ng maaga ngayon and we will resume at 12:45. Okay? Do you have questions first before we take a break? Class, ang lakas ng ulan. Baka maanod tayo. Hindi, joke lang. Any questions? Before we
Wala,
take
sir.
a break? Yan. So break muna tayo, class, ha? Resume tayo ng 12:45. Okay, thank you for listening.
Thank you, sir.
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 Thank you, sir. Salamat po, sir.
sulfate is contraindicated. So pag single contrasts, we use only barium sulfate or water-soluble iodinated contrast medium. For the double contrasts in the upper GI series, we use barium sulfate and any gas-producing substance. So what is the advantage? And the answer here, in the double contrast examination, we usually demonstrate the small lesions or what we call the polyps in the mucosal lining, which can be demonstrated. So in the double contrast, we usually demonstrate polyps dahil sa single contrast, seldom na nade-demonstrate yung polyps or the small lesions in the mucosal lining of the stomach. So that can be demonstrated well in the double contrast. Wait lang, class. Okay, so yan ang advantage natin ng double contrast examination. Yung polyps or the small lesions can be demonstrated in the mucosal lining of the stomach. Then number 7, question 27, which description refers to the biphasic gastrointestinal series examination? Pag sinabi nating biphasic, in other words, dalawa, dalawang examination. So in other words, that is a combination of a single contrast and double contrast study of the upper GI tract examination. So I repeat, pag sinabi nating biphasic GI examination, that is 2 examination. Dalawa, a combination of a single contrast and a double contrast study of the upper GI examination or upper GI tract. So tandaan pag sinabing biphasic, in other words, dalawang examination yun, hindi dalawang procedure, dalawang examination, combination of a single contrast and a double contrast study of the upper GI. Next question, 28, for the PA projection as part of the upper GI examination, why should the lower lung fields be included in the 14 by 17 inch or 35 by 43 cm image receptor? So the answer here, in order to demonstrate a possible hiatal hernia. So to demonstrate a possible hiatal hernia, that's why 14 by 17 cassette is being used in the upper GI series examination. Laging tatandaan, pag nabasa ang word na hiatal hernia, hindi size ng film ang pinag-uusapan natin doon. Possession, where we can demonstrate the possible hiatal hernia. Anong possession? Pag nabasa ang hiatal hernia sa upper GI series examination, laging tatandaan na ang possession ng pasyente dyan ay Trendelenburg possession. So pag sinabi nating Trendelenburg possession, the head is lower than the feet. Tandaan, pag hiatal hernia ang i-demonstrate natin, hindi natin pinag-uusapan dito ang size ng field na gagamitin. Baka isipin nyo pag sinabing hiatal hernia, ang kailangan nating gamitin ay 14 by 17 lagi. Hindi. possession of the patient ang pinag-uusapan natin. So dito lang sa question, bakit 14 by 17 ang ating gagamitin na cassette in order to demonstrate or to include a possible hiatal hernia. Okay? Next question, number 29. Yan, for the double contrast upper GI examination, which projection produces the best image of the gas-filled duodenal valve and pyloric canal? So which projection produces the best image of a gas-filled duodenal valve and pyloric canal? And the answer here, we have the RAO possession, PA oblique. Pag sinabi nating PA oblique, in other words, that could either be LAO or RAO. PA oblique yun. Ha? So, pag sinabi nating PA oblique, that could either be RAO or LAO. Kaya lang ang pinag-uusapan ang question dito, best image daw ng duodenal valve and pyloric canal. So walang ibang sagot dyan, kundi the right answer. So according to the board of RADTECH, common question nila yan, that the best image or the best projection demonstrating the pyloric canal and the duodenal valve, that is RAO, wherein the patient is in recumbent position. I repeat, when we say RAO recumbent position, the patient is lying on his abdomen on top of the table. Okay, so that is PA oblique recumbent position, RAO. So as you can see, that is the RAO possession, diba? And this possession, wherein the peristalsis is usually more active. So minsan tanong din sa board exam, which of the following possession in the upper GI wherein the peristalsis is more active? The answer here, that is RAO. Now, so ang RAO possession, that is the possession wherein the peristalsis is more active. So ilang degrees ang body rotation natin dito? That is, the body is rotated by 40 to 70 degrees. But this depends according to the type of stomach or the stomach habitus. Depende. Depende kung sa sthenic, asthenic, hyposthenic, and hypersthenic. So that depends on the type of body habitus. So normally, in the RAO, upper GI series examination for the demonstration of the duodenal valve and pyloric canal, the body is rotated by 40 to 70. So bakit 40 to 70? So in other words, po pwedeng 40 degrees ang body rotation, po pwedeng 50, 60, or 70 degrees body rotation. I repeat, RAO, that is the position wherein the peristalsis is more active. Okay, next question, number 30, for the upper GI examination with the patient recumbent, which projection best stimulates gastric peristalsis to better demonstrate the pyloric canal and duodenal valve? So kung titingnan natin ito, halos magkapareho ang sagot, pareho ang tanong, parang modified lang ng konti ang tanong, but this is the same gests ng question and the answer. So the answer here is RAO pa din. No? So dahil pyloric canal and duodenal valve, which stimulates the gastric peristalsis. Now, so that is RAO pa rin. Next question, which breathing procedure should the patient perform when upper GI radiographs are exposed? So, laging tatandaan, all abdominal x-rays, the instructions given or the physiologic maneuver is suspended expiration. So, laging tatandaan yon, yung breathing procedure, pag stomach or abdominal x-rays, or any special procedures examination, ang instructions or the physiologic maneuver to be given to patient is suspended expiration. So pag sinabi nating suspended expiration, in other words, we instruct the patient labas ang hangin, tigil, that is suspended at the end of exhalation. So pag sinabi natin expiration, that is similar with exhalation. Yan. So all upper GI series, all abdominal x-rays examination, the instructions given is expiration, suspended expiration. Labas ang hangin, tigil ang paghinga. Next question for the upper GI examination with the patient recumbent, which projection best demonstrate the right retrogastric space? So sa upper GI examination, syempre meron tayong right lateral recumbent. Pag sinabi nating right lateral recumbent, meron tayong right lateral recumbent, meron din tayong left lateral recumbent. So pag naka-right lateral recumbent tayo, anong dine-demonstrate natin? The right retrogastric space. So pag right lateral recumbent, right retrogastric space. So that is the position, the example position for the right lateral recumbent. Now, wherein the right side is close in contact to the table and the central ray is perpendicular or vertically directed. So that is right lateral recumbent in the upper GI, demonstrate the right retrogastric space. Yan. So pag naka-left lateral recumbent naman, syempre, the left retrogastric space naman ang dine-demonstrate. So pag right lateral, the right side is close in contact to demonstrate the right retrogastric space. Kung naka-left lateral projection naman tayo, the left retrogastric space can be demonstrated. For the AP projection with the patient supine, which procedure should be performed best demonstrate the diaphragmatic herniation? When we say diaphragmatic herniation or hiatal hernia, ano nga ulit ang keyword natin para masagot ang hiatal hernia or diaphragmatic herniation? Laging Trendelenburg position. Yan, very good. Laging tatandaan ha, huwag kalilimutan. Bahala na kahit na anong tanong. Basta may diaphragmatic herniation or hiatal hernia in the upper GI, walang ibang sagot doon na hahanapin mo is Trendelenburg position. Which structure, when visualized on a radiograph, part of a small bowel series, usually indicates the completion of the examination? So sabi natin kanina, sa small bowel series examination, ano ang other word nga dyan sa procedure? Barium follow-through. No? So pag sinabi nating barium follow-through, small bowel series examination yan. So ito yung sabi nga natin, pag small bowel series examination, normally, meron tayong patient preparation dyan, di ba? Ano ang patient preparation natin? That is NPO. Kailan tayo nag-NPO, class? Sagot. Kailan tayo nag-NPO? Sa mga procedures. Special procedures, upper GI, barium enema, IVU or IVP, yan. Small intestinal series examination or SIS or small bowel series, tatandaan, ang NPO laging after midnight. Walang oras tayong pinag-uusapan dyan. Ha? Pag sinabing NPO, always remember after midnight yan. Ha? NPO. So kailan natin nasasabi na complete na ang examination ng small bowel series examination? When the barium sulfate is already in the cecum. So kung ang barium sulfate ay nasa cecum na, in other words, complete na ang examination noon. So pag sinabing complete ang examination, kailan nagiging complete ang examination? The examination in the small bowel series examination is completed within 30 to 60 minutes. So ang completion ng small bowel series, yan, kung ang barium sulfate ay nasa cecum na. So with the barium reach the ileocecal region, fluoroscopy may perform. So tinitingnan niya ng doktor, ng radiologist, di ba? Pag nakita niya na ang barium ay nasa ileocecal region, yan, mag-uumpisa na yan ng mag-perform ng fluoroscopy. So when the barium is visualized in the cecum, in other words, complete na ang examinations. Ilang projection na lang yun. Usually, pag small bowel series examination, 4 na projections lang yan. 4 din na film ang ginagamit. Lahat ay big film na tinatawag natin. Pag sinabi nating big film, that is 14/17 with time interval. So uulitin ko ulit, ang small bowel or small series or intestinal series exam, merong time interval. The first exposure, that is 15 minutes, 30 minutes, 45 minutes, and 60 minutes. So ang examination is complete within 30 to 60 minutes. Next question, which instructions should be given to the patient if cramping is experienced during filling of the large intestine for barium enema examination? So sometimes, ang pasyente nakakaramdam yan na parang sasabog na ang tiyan, di ba? Sa barium enema examination habang pinupuno sa large intestine or in bowel or in barium enema examination. So anong instructions na binibigay? Usually, common na binibigay natin, sir, ma'am, hinga lang po kayo ng malalim. Hinga lang sa bibig. So kung may nararamdaman na parang taing-tain na ang pasyente or cramping, masakit na ang tiyan ng pasyente, normally ang instructions natin na binibigay is oral, deep oral breathing. Hinga lang po kayo sa bibig. Yun lang, nawawala yon. Or kung hindi man mawala, hindi talaga kaya, hindi naman po pwede ding maidumi yun, dahil nakabalon. Pero minsan, pag pinipilit ng pasyenteng idumi, lumalabas kahit na hindi yung balon, yung tip ng balon doon sa catheter. But sometimes we ask the nurse or the doctor, binibigyan siya to relax the intestine. Normally, ano ang binibigay na medication to relax the intestine? Yung, ano bang meds yun ang binibigay? I forget the medications na binibigay sa pasyente para hindi siya madumi, to relax the intestine. But this is the instructions given. Concentrate on deep oral breathing to relax the abdominal muscles and to prevent abdominal pressure. Yan ang instructions, the basic instructions to be given. Before the enema tape is inserted during the barium enema, why should small amount of barium sulfate mixture be allowed to run into a waste bin, diba? Or into a waste basin? Sa enema, sa barium enema, minsan nakakabit na ito, nakakabit na tayo. Sa barium enema, nakakabit na dito sa catheter and the enema can. Then minsan bago ipasok yung tip ng catheter, minsan pinapatulo muna. Di ba kung napapansin, kung ikaw ay RADTECH, pwede ka munang pinapatulo muna doon sa waste sa basurahan, na konti yung barium sulfate. Ano ang rason? Bakit kailangan patuluin? Bakit hindi na lang idiretso? The purpose, to remove air from the tube. Yan ang purpose. Why a small amount of barium sulfate mixture be allowed to run into a waste basin? Yan ang purpose, to remove air from the tube. Yan. Normal yan ang ginagawa natin. For the PA projection, during barium enema, what is the advantage of placing the X-ray table and patient in a slight Trendelenburg position? Yan, ito na naman tayo, barium enema. So, Trendelenburg in upper GI, sabi nga natin, for hiatal hernia or diaphragmatic herniation. Dito naman sa barium enema, PA projection, bakit tayo nag-slide Trendelenburg position while the patient is in recumbent or in prone position? Ano ang purpose natin? Yan, in order to prevent redundancy of colon or to separate the overlapping of loops or in the distal bowel. So yan ang purpose naman natin. In PA projection sa barium enema, ano ang advantage? Bakit kailangan naka-slide Trendelenburg position ng pasyente? The purpose is to help separate overlapping of loops and the distal bowel, or in order to prevent the redundancy of the colon. So yun ang reason, bakit naka-slide Trendelenburg tayo sa PA projection in barium enema examination. Next question, how many degrees and in which direction should the central ray be directed for the PAHL projection during barium enema? So sa barium enema class, naggagawa tayo or nagpe-perform tayo ng PA-axial projection sa barium enema. Ano kaya mga reason? Bakit pag sinabi nating axial, in other words, there is a central ray angulation of 10 degrees or more. Diba? Yan ang PA-axial PA-axial projection. Nag-angle tayo. Yan. Pag sinabing axial, 10 degrees or more ang angulation natin. Ano ang reason? So the reason is to demonstrate the rectosigmoid colon or the rectosigmoid area. So that is the PA projection, or that is PA-axial projection during the barium enema examination. So the central ray here is 30 to 40 degrees caudally to demonstrate the rectosigmoid. So to demonstrate the rectosigmoid. Kaya lang meron tayong the best method to demonstrate the rectosigmoid colon. Ano nga yung best method natin? What we call the ano nga ulit yun? The jackknife possession. Yung jackknife possession o yung Chazard lapine pala. No? Chazard lapine, or that is known as jackknife possession. That is the best method or possession demonstrating the rectosigmoid area, wherein the central ray is PA-axial, 30 to 40 degrees caudally. Hindi yung jackknife, hindi yung Chazard lapine ang naka-angle. No? Ang naka-angle natin dito, yung PA projection to demonstrate the rectosigmoid. Dahil ang Chazard lapine or jackknife possession, the central ray there is just perpendicular to demonstrate the rectosigmoid. Which two oblique projections can be performed to best demonstrate the left colic flexure during a barium enema examination? So, mayroon tayong dalawang oblique projections na nagde-demonstrate ng left colic flexure. So, pag sinabi nating left colic flexure, that is referring to splenic flexure. No? Splenic. So, ano itong dalawang projections na ito na nagde-demonstrate ng left colic or the splenic flexure? We have the LAO possession. Pag sinabi nating LAO ulit, the patient is perpendicular, perpendicular. The patient is in prone, diba? Prone possession, and LPO, wherein the patient is in supine. LAO and RPO. That is where the patient is in supine. So magkaiba. Pag LAO and RPO, yan ang nagde-demonstrate ng left colic flexure or the splenic flexure. So this is the example, and itong nasa left image mo, that is the LAO, and that is, kung mapapansin mo, that is the splenic flexure. Yan yung nasa image. At itong nasa right side mo, ay yan ay ang RPO. The same purpose ang dine-demonstrate niya. The splenic flexure or the left colic flexure. Next question, which barium enema projection does not require colic flexure to be included in the image? So kung titingnan natin, di ba? Alin daw dito ang projection na hindi nagre-require na ma-demonstrate ang colic flexure in the image? Pag AP projection, nade-demonstrate ba ang colic flexure? Yes. Di ba dahil sa AP projection ng barium enema, both flexures can be demonstrated, the left and the right. The hepatic, the splenic, and the hepatic flexure. Pag RAO, anong nade-demonstrate? Nade-demonstrate din dyan ang right colic, di ba? Ang lateral decubitus, nade-demonstrate yan yung mga colic flexures. So the answer, we have the lateral projection. Ito lang ang projection na hindi nagre-require ng colic flexures to be included in the image. Dahil ano lang ang dine-demonstrate natin dito sa lateral projection? Only the rectum. Rectum lang ang dine-demonstrate sa lateral projection, and normally sa barium enema examination, ang lateral projection, yan lang ang yan ang first projection in performing the barium enema examination. 'Di ba? Yan ang ginagawa ng doktor, ng radiologist. First projection to be performed in barium enema examination. So ano lang dine-demonstrate, I repeat, ng lateral sa barium enema, only the rectum can be demonstrated. And this is the best projection demonstrating the rectum, that is lateral projection. Next question, Which cyanographic projection directs the central ray along the mandibular ramus? Yan. So cyanographic projection directs the central ray. Ano ang central ray? Along the mandibular ramus. So we have the tangential projection. So ang tangential projection, that is where the central ray is directly to the mandibular ramus. Yan. Sa lateral, saan ang nagdadirect ang central ray, or rather the reference point, in the lateral, in the superior to the mandibular angle. So it directs superior to the mandibular angle. Kung ang tanong, which cyanographic projection directs the central ray and direct the central ray in the mandibular angle, yan, that is lateral projection tayo dyan. For the lateral projection, number 42, for the lateral projection demonstrating the submandibular gland, what is the purpose of pressing the tongue to the floor of the mouth? So sa lateral projection ng submandibular, di ba sa cyanography examination, meron tayong procedures dyan. Meron tayong dinidemonstrate the parotid, the submandibular, and the sublingual or submaxillary. Submandibular or submaxillary gland, parotid gland, and sublingual gland. So in the submandibular gland, ano ang purpose? Why? Pressing the tongue to the floor of the mouth. Then ipipress mo lang naman papunta doon sa tongue. Ano ang purpose? To hold the intraoral film in place. Yan lang ang reason, no? Yan ang reason bakit kailangan nakapress ang tongue to the floor of the mouth para ma-hold yung intraoral film. So pag sinabi nating intraoral film, because in cyanography examination, for the demonstration of the submandibular or submaxillary, we use the occlusal film. So pag sinabi nating intraoral film, that is referring to the occlusal film. Maliit, hindi naman pwedeng kagatin natin ng 8x10, no? Dahil napakabigat yon. So pag sinabi nating intraoral film, that is referring to occlusal film. So yan ang reason why we need to press the tongue to the floor of the mouth. So in cyanography examination, usually this use demonstrates the unobstructed view of the sublingual gland regions. And this is also used to demonstrate the tumor masses or lesions that lie posterior or lateral to the floor of the oral cavity. So yan ang dine-demonstrate natin sa cyanography. Salivary glands and ducts in particular. So yan ang dine-demonstrate natin. Next, number 43, for preliminary AP and lateral projections that demonstrate the pharynx and larynx, when should the exposures be made to ensure filling the throat passages with air? So in preliminary, or pag sinabi nating preliminary, that is referring to the scalp film, AP and lateral projections that demonstrate the pharynx and larynx. When should the exposures be made to ensure filling the throat passages with air? So the instructions is during inspiration. And to ensure filling the passages with air, the patient should be instructed during inspiration. Yan, doon ini-instruct. During myelography, which procedure should be performed to prevent contrast medium from entering the cerebral ventricles? So sa myelography, that is, anong procedure ito? Myelography, this is a tawag natin sa procedure nito, interventional procedure, usually kasi nakabihis yan yung mga doctors, ito yung nag-assess na yan. So in order to prevent contrast medium from entering the cerebral ventricles, the patient have the patient neck extended. So hyperextend the neck. And yun ang reason para ang contrast medium hindi pumasok sa cerebral ventricles. Dapat naka-hyperextend. Hyperextend the patient's neck. Dahil kung hindi naka-hyperextend ang patient's neck, pumasok ang contrast medium sa cerebral ventricles, what will happen? Deads ang pasyente dyan. Patay ang pasyente. pag hindi naka-hyperextend ang neck in myelography examinations. So, laging tatandaan na lagi pag nag-myelography examinations, regardless kung cervical myelography, thoracic myelography, or lumbar myelography, you should see to it that the head should be hyperextended. Ano ang reason? Bakit kailangan i-hyperextend? To prevent the contrast medium from entering the cerebral ventricles. Next, number 5, osmolarity of a solution refers to the blank solution. Osmolarity refer to the volume of the solution. So when we say osmolarity of a solution refers to the volume of the solution. So normally, concentration of osmoles in a volume of solvent. No? So volume is the answer. Renal insufficiency is indicated if the BUN exceeds how many milligrams per DL, and the creatinine level is above how many milligrams per deciliter. And so the answer here, and that is 20 BUN. The normal is 20 pag nag-exceeds yan. Yan. Patient with elevated blood levels have a greater chance of experiencing on adverse contrast medium reactions. Yan. So kung elevated ang blood levels ng pasyente, yan, more chance, mas risks. Yan, the patient may experience an adverse reactions of the contrast medium. So the normal creatinine levels for the adult, that is around 0.6 to 1.5 milligrams per DL. No, that is the normal creatinine level for the adult. And for the normal BUN, your BUN levels, that is ranging between 8 and 25 milligrams per 100 ml. Yan, between 8 and 25 milligrams per 100 ml. So renal insufficiency is indicated if the BUN exceeds 20 or the BUN exceeds 20. Yan. And the creatinine level is more than 1.5. So ibig sabihin, pag may ganitong mga readings sa laboratory test ng pasyente, hindi po pwedeng ituloy, no, ang intravenous or the IVU or the IVP or the excretory urography. Hindi po pwedeng ituloy pag nag-exceeds dito. And those are the normal creatinine levels, and these are the BUN levels. The use of intravenous setup approximately 30 cm above the duct introduces the contrast agent. No? Pero kung titingnan natin ang tanong, no, parang ano kaya tinatanong dito? No? The use of an intravenous setup approximately 30 cm above the duct introduces the contrast medium. So ano bang ginagamitan natin? With that is where the contrast medium is being introduced in the duct. Ano lang ba ang procedure? So pag duct, in other words, it could either be salivary glands. Salivary glands. So in other words, it should be by hydrostatic pressure. So the distance of the hydrostatic pressure or during the introduction of the contrast agent in the duct, it should be between 28 or 72 cm above the level of the mouth through hydrostatic pressure. So through hydrostatic pressure, in other words, the hydrostatic pressure should be 30 cm above the duct or above the mouth. So that is 28 or 72, 28 inches yan. 28 inches or 72 cm above the level of the mouth. The movement of certain contrast agents by gravity is because the agents are movement by gravity. So the answer here is hyperbaric. The movement of certain contrast agents by gravity, it is because the agents are hyperbaric. To demonstrate esophageal varices, the patient must be examined in. So saan ba itong esophageal varices? This is one of the pathology which can be seen or which can be demonstrated in the esophagogram or in the barium swallow. So to demonstrate the esophageal varices, the patient should be in erect position. So to demonstrate the esophageal varices, ang pasyente dito ay naka-erect position. Pero naka-oblique yan. So the instructions given, instruct the patient to exhale fully and swallow the barium bolus to avoid inhaling until the exposure has been made. So ang instructions natin, di ba? Pag gumamit tayo or pag nagde-demonstrate natin tayo to demonstrate the esophageal varices, binibigyan natin ng patient ng instruction. So sige, labas muna po ang hangin, then swallow po ang barium, pero bawal pong huminga muna hanggang wala pang exposure. Diba? So this is the instructions to be given. This is the instructions to be given to patient. Sandali lang pa sa, tingnan ko lang yung message. Okay, wala. Class, do you have questions? Malinaw ba, class? Naiintindihan nyo ba yung discussions natin? Tay. Naiintindihan ba? Hoy, tulog na ba kayo? Baka naman
Naiintindihan po.
Baka naman
Naintindihan, sir.
yan, baka naman natutulog yung iba dyan, naka-on lang tapos wala pala, tapos mamaya magtatanong, sasampaling ko kayo eh. Yan. Sayang yung oras, di ba? Hindi yung iba, mas style dyan, yung iba. Total, view naman natin yan. May access naman tayo sa kanilang natin yan ulit pakinggan. Naka-on lang para kunyari kasama sa attendance. Yung nandadaya, hindi siniswerte yan. Kinakarma yan. Tama? Bawal mandaya. Mag-aral ng mabuti dahil malapit na ang board exam. December na. Hindi yun malayo, class. Malapit na. September na ngayon. So dapat kabisado nyo na para pag nagkita tayo ng face-to-face, wala nang problema. Yun ang review na. Di ba? Review. Para wala tayong problema, nagkakaintindihan tayo. Pakialam mo, sir, kami naman yung mag-e-exam. Siya nga naman, di ba? Kayo naman pala mag-e-exam, hindi naman pala ako. Joke lang. Next! Number 50, a post-motor meal is given to the patient in OCG. Pag sinabi nating OCG, in other words, that is referring to the oral cholecystography. Oral chole. Yan. So, ibig sabihin, binibigyan, ano ba itong post-motor meal? So, after the procedure, binibigyan ng pasyente ng mga pagkain, no, na ma-oily. Yan, yung eggnog, sandwich, na mayroong cheese. Yan, post-motor meal is given to the patient in oral cholecystography. Ano ang purpose? Ano ang purpose? Bakit kailangan pinapakain ang pasyente ng oily? Yan, to evaluate function of the gallbladder. Yan, dahil in the oral cholecystography, ano ang dine-demonstrate natin dyan is gallbladder. So gallbladder ang dine-demonstrate. Pag nag-demonstrate tayo pag gallbladder, in other words, para makita ang function. Normally, ang oral cholecystography class, ginagawa ito, ang patient preparation natin dito is not less than 12 hours. Huh? Not less than 12 hours. Normally, that is 10, 12, 14 hours ang patient preparation. Unlike with the other procedures like upper GI, barium enema, IBP, ang patient preparation lang natin dyan ay NPO after midnight. Di ba? Yan lang ang patient. Normally, that is a maximum of 6 hours patient preparation. So pag ang pasyente naka-NPO na after midnight, yan ang common patient preparation. Dito sa oral cholecystography, ang ating patient preparation here, it should not be less than 12 hours patient preparation. So ang pasyente, then sa procedure, magre-report na yan sa X-ray department. So 12 hours, bawal kumain yan ng mga oily foods. No? Then kukuhaan ng procedures, LAO and lateral or right lateral. Then after ng dalawang procedure or dalawang projection, the patient should be given a motor meal foods, no, yung oily. Ano ang purpose? Para mag-function ang gallbladder, para makita. No? Yeah, that is the purpose of post-motor meal. When performing the apiaxial oblique projection of the cervical vertebrae in a supine trauma patient, how should the cervical or how should the central ray be directed if only one angle is used? Yan. Dito sa AP oblique projection ng cervical vertebrae, meron tayong dalawang klaseng AP oblique projection, no? To demonstrate sa cervical vertebrae, meron tayong RPO at meron tayong LPO to used in the AP axial. So, ano ang dine-demonstrate natin? Normal, dito sa oblique natin ng cervical, dalawa. The pedicels and the intervertebral foramina. Pedicels and intervertebral foramina, yan ang dine-demonstrate natin sa oblique projection ng cervical. So, wala pa tayong sinabing AP oblique pa o PA oblique. Oblique projection in general. So, for oblique projection of the cervical vertebrae, mayroon tayong, ang dine-demonstrate natin dyan ay intervertebral foramina and pedicels. So, dito sa tanong, AP axial. So, kung naka-AP axial oblique, ano ang position natin dyan? So, it could either be RPO or LPO. So, kung naka-RPO or LPO ang pasyente, ano ang central ray natin? 15 degrees sipalad. So, kung naka-RPO and LPO ang pasyente sa cervical and vertebrae, ang central ray natin ay 15 degrees sipalad. And ang reference point natin dyan ay C4, AP oblique. Kung ang pasyente ay naka-PA oblique, kung naka-PA oblique naman ang pasyente, it could either be RAO or LAO. Ang central ray naman nila dyan ay 15 degrees caudally naman. So, kung ang pasyente ay naka-PA oblique, pag sinabi natin PA oblique, either RAO or LAO, ang central ray natin dyan ay 15 degrees caudally. Pero dito sa AP oblique, that is AP oblique or posterior oblique, either RPO or LPO, ang central ray natin dyan ay 15 degrees sipalad naman. So this is the example of our, anong example yan? Anong possession yan? So that is LPO. Diba? LPO. Anong dine-demonstrate? Pag naka-LPO or RPO ang pasyente, anong dine-demonstrate natin? The farthest intervertebral foramina and pedicels. So katulad halimbawa yan, naka-LPO yan. So anong dine-demonstrate natin na intervertebral foramina and pedicels? The right intervertebral, the farthest. Ano pa ang term na ginagamit ng examiner dyan? Farthest, remotest, or elevated. Yan ang tatlong words na ginagamit ng examiner dyan. Pag sinabing farthest, that is also using remotest, or that is also using elevated. So halimbawa, yung possession na yan ay naka-LPO. Anong dine-demonstrate natin dyan na intervertebral foramina and pedicels? The right, the farthest, the elevated, the remotest. So aside from the demonstration of the intervertebral foramina and pedicels in the obliques, it is also used to demonstrate the intervertebral disc spaces. Intervertebral disc spaces can also be demonstrated. Yan, oblique yan. Normal yan, class na oblique, ha? Pero kung ang pasyente naka-RAO or LAO, the closest naman. Pag naka-RAO or LAO, halimbawa, ang pasyente ay naka-RAO ang possession niyan, oblique, RAO. So, ang dine-demonstrate natin dyan ay right intervertebral foramina and pedicels, as well as the intervertebral disc spaces can be demonstrated kung naka-RAO, the closest. So kung naka-RAO, the right side is the closest, and that is the one being demonstrated. The same process with the LAO, yung closest natin. Okay, so with that possession, naka-oblique, meron tayong AP oblique hyperflexion and hyperextension. Ano lang ang instructions na binibigay natin dyan sa ganyang possession? Hyperextend the chin. With that possession, and instruct the patient to hyperextend the chin. And the AP oblique, hyperflexion and hyperextension, and that is the functional studies. That is the functional studies of the cervical vertebrae. So tandaan, pag tinanong what is the functional studies of the cervical vertebrae, walang ibang sagot kung hindi hyperflexion and hyperextension. Dahil mayroon din tayong hyperflexion and hyperextension studies of the cervical na ang pasyente ay nakalateral. Di ba? Mayroon tayong lateral hyperflexion, mayroon tayong lateral hyperextension. And that is the functional studies of the cervical vertebrae. So ibig sabihin, regardless whether nakalateral or naka-AP oblique, for as long as hyperflexion or hyperextended ang chin, and that is the functional studies of the cervical vertebrae. So dito sa AP oblique hyperflexion and hyperextension, ano pa ang dine-demonstrate natin dito? To show fractures of the articular processes and obscure dislocation and subluxations. So to show fractures of the articular processes and obscure dislocations and subluxations can be demonstrated and the AP oblique hyperextension and hyperflexion. So ano nga ulit ang difference between the dislocation and the subluxation? So the difference between dislocation and subluxations, pag sinabi nating subluxation, in other words, that is referring to the partial displacement of a joint. Partial displacement of a joint. Pag sinabi naman nating dislocation, that is referring to the total displacement of a joint. So total displacement of a joint is dislocation, and partial displacement of a joint, that is subluxation. So what is the other term for dislocation? That is referring to lux, no? L-U-X. So lux, that is the other term for dislocation. So yan ang dine-demonstrate natin, class, ha, ng AP oblique hyperflexion and hyperextension studies. Laging tatandaan, pag sinabing hyperflexion and hyperextension, regardless whether that is an AP oblique or lateral, that is the functional studies of the cervical vertebrae. Laging tatandaan din na ang reference point yan ay laging C4, regardless whether it is an oblique or it is in lateral projection. Next question, how should a radiographer determine if an AP projection of the abdomen, the left lateral decubitus possession is being requested for demonstrating free air or fluid levels? Laging tatandaan natin, class. Tatandaan kung ang ide-demonstrate natin ay air level or fluid level, ibig sabihin, dalawang possession lang ang pwede dyan. To demonstrate free air or fluid levels, isa lang, dalawang projections lang. Ano yung projection? Isa, the patient is in recumbent position. At yung pangalawa, the patient is in recumbent, sorry, I stand corrected. Isang upright position at yung isa lateral decubitus. So pag walang specific kung anong lateral decubitus, left lateral decubitus is being performed. Laging tatandaan yon, ha? So kung ang ide-demonstrate natin air level sa abdomen or fluid level sa abdomen, dalawang projections lang or dalawang possessions lang ang pwedeng i-perform. Upright, kung hindi kayang tumayo ng pasyente, lateral decubitus. Pero kung hindi specific kung anong lateral decubitus, it is advisable that you have to take it in left lateral decubitus. Lagi yon. Kung walang specific kung anong lateral decubitus, automatic na ang gagawin mo ay left lateral decubitus. So dalawang position lang yan, ha? Balikan natin ang tanong, how should a radiographer determine if an AP projection of the abdomen, the left lateral decubitus possession is being requested for demonstrating free air or fluid levels? The answer, yan, ask the attending physician. Yan, pag hindi makita, usually class kasi, pag mayroong penetrating wounds, in other words, always lagi yon na mayroong air level. But para sure, ano ang gagawin? Siyempre, you have to ask the physician. Tatanungin yung attending physician. Pero laging tatandaan natin, kung nakita mo na mayroong penetrating wounds, hindi ka naman doktor, di ba? Pero laging tatandaan na automatic mayroon lagi yang air level. Mayroon lagi niyan pneumothorax pag mayroong penetrating wounds. But in order to be sure, you have to ask the attending physician. Which of the following procedures should a radiographer perform if a trauma patient with a head injury displays unequal pupils? No, baka naman duling lang. That's all lang. So unequal pupils. Malay mo naman kung duling lang yon. Sinabi mo lang, tabingi ang kanyang mga mata. So kung ang radiographer nag-perform, mayroong trauma patient with a head injury, nakita na mayroong head injury, o nakita mo na hindi pantay ang kanyang mata dahil duling, walang magawang magaling, joke lang yan. Diba yan kasabihan? Pag duling, walang magawang magaling. Yan. So ano ang gagawin? Huwag ka nang magalingan. Inform the attending physician. So tingnan, ipakita doon. Baka naman pagdating, inom muna ho kayo ng tubig, wala ka namang kinalaman doon, mamaya namatay pa yon. Diba? Or magbigay ka ng immobilization device. Or irarag roll mo ulit ang pasyente. So dahil kung trauma ang pasyente, merong head injury, hindi mo pwede siyang galawin. Diba? I-x-rayhin mo lang kung saan siya naandun. X-rayhin mo lang especially sa ER. But you have to immediately inform the attending physician kung meron kang napansin na kakaiba. Pero siyempre, kung nasa ER, tanong lang ino, this is just a question. No? This is just a question para at least makita lang kung how will you analyze the question. Pero in actual setting, hospital setting, hindi naman. No? Dahil galing naman yan sa ER, sila naman ang nag-identify siya. Which of the following projections should be the first one performed for a multiple trauma patient? Multiple trauma patient. Nasagasaan ng pison, for example. Buhay ka pa? Siyempre, pag gasaan ka ng piso, di durog-durog ganyan. Which of the following projections should be the first one performed for a multiple trauma patient? Yan, tanong lang din ito. Pero ang pasyente galing sa ER, doktor na ang nagbibigay ng instructions, no? Ano ang request na projections ng doktor. Pero dito sa tanong, kung mayroong multiple trauma patient, automatic naman natin na ine-explain natin sa ER ay lateral cervical spine. Lateral cervical spine, cross-stable lateral or dorsal decubitus possession. Pag sinabi natin class dorsal decubitus possession, that is where the patient is in supine position. Nakasupay ng pasyente, no? Wherein the central ray is horizontally directed. So kung mayroong multiple trauma patient, ang una mong gagawin, syempre, yan, i-x-rayhin mo ang lateral cervical, cross-stable lateral ang tawag doon. Diba? Saan nakalagay? Na naka-dorsal decubitus, nakasupay ng pasyente, at ang kaset nandito sa side ng pasyente, no? Nasa side ng pasyente ang kaset. Yun, that is lateral cervical spine or dorsal decubitus position. Do you have questions, class? Next, number 55. Which evaluation criterion pertains to the lateral projection radiograph of the chest? Which evaluation criteria pertains to the lateral projection radiograph of the chest? Yan. Ano ba ang criteria na tinitingnan natin pag nagla-lateral projection of the chest tayo? Normally, pag mayroon lateral request ng lateral APL, di ba? Mayroon yun laging request ng pasyente or PAL, pag chest x-ray. So pag chest x-ray, PA and lateral, normally, the left lateral is always, di ba? Yan lagi ang ginagawa natin, na? Left lateral projection, wherein the left side of the body must be close in contact to the vertical cassette holder. So always yon kung mayroong request na chest x-ray, and it should be given in upright or it should be taken in upright position. Laging naka-upright ang pasyente pag may requests na ng chest x-ray. So what is your answer here? Ano ang criteria? When the ribs posterior to the vertebral column should be superimposed. Yan. So ito yung criteria. Hindi yung amount of the heart should be seen on the right side. Kasi ang heart naman, hindi naman mo makikita kung di ba dahil naka left side naman, naka close in contact. Yan. So, yan ang description, no? That is the criterion for the lateral projection. Next number, using a lateral decubitus position for patients who are unable to stand upright, best demonstrate which of the following pathologic conditions of the chest. So ito yung tinanong natin kanina, di ba? Yan ang diniscuss natin, using a lateral decubitus position for patients who are unable to stand. Sabi nga natin, kung ang pasyente ay mayroong air level, mayroong fluid level, or any pathology conditions for that matter in chest x-ray examination. Dalawang projections lang. Isang lateral decubitus at isang upright. Na? Yan. So dahil dito, using lateral decubitus, hindi naman kayang tumayo ng pasyente. Anong dinidemonstrate? Air level or fluid levels. Yan. Pero, wait lang ha. Patingin nga ako ng lecture ko dyan. Okay, so that is for the lateral decubitus when the patient is unable to stand upright. Yan, ang dinidemonstrate natin ay air and fluid levels. Okay, next number, which PA oblique projection of the chest may be electric fan, please? Which PA oblique projection of the chest may be used to evaluate the heart and the great vessels? Yan, heart and great vessels. Ang pinag-uusapan natin dito, class, pag narinig itong heart and great vessels, cardiac series examination tayo dyan. Ha? Pag heart, PA projection of the chest, no, may be used to evaluate the heart. Normally, ang oblique o PA oblique projection of the chest, di ba, ang dine-demonstrate natin dyan ay lungs. Di ba? Kaya lang dito, PA oblique projection of the chest to evaluate the heart and great vessels. Yan, cardiac series yan. Anong oblique natin dyan? So that is 55 to 60 degrees. 55 to 60 degrees left anterior oblique for the evaluation of the heart and great vessels. Dahil for the evaluation of the lungs, yan, 45 degrees naman ang body rotation natin dyan. Diba? For the evaluation of the lungs, ilang degrees ang PA oblique ang body rotation? 45 degrees. For the evaluation of the heart and great vessels, ilang degrees ang body rotation sa PA oblique of the chest? 55 to 60 degrees. Specifically, anong oblique yan? Anong PA oblique? LAO. Yan. So for LAO, that is 55 to 60 degrees. Kung ang ide-demonstrate natin ay pulmonary disease, PA oblique, to evaluate the pulmonary disease using PA oblique projection of the chest, ilang degrees ang body rotation? 10 to 20 degrees. No? 10 to 20 degrees for RAO and LAO. So laging tatandaan, ha? PA oblique of the chest. Kung ang i-evaluate natin ay lungs, 45 degrees ang body rotation natin, RAO and LAO. Kung ang i-evaluate natin ay heart and great vessels, that is referring to cardiac series. So ang body rotation natin using PA oblique of the chest is 55 to 60 degrees. Specifically, anong best projection natin dyan? LAO. Kung ang i-demonstrate natin ay pulmonary disease or kung ang i-evaluate natin ay pulmonary disease using PA oblique projection of the chest, we have to rotate the body slightly. Ilang degrees lang? 10 to 20 degrees for RAO and LAO possession. So for RPO and LPO, the lung field of the elevated side, halimbawa, naka-RPO ako. So RPO and LPO, sabi nga natin, the patient is in supine position or that is referring to posterior oblique. So pag naka-RPO ako, the lung field of the elevated side or of the left side appears shorter because of the magnification of the diaphragm. So in other words, kung ako ay naka-RPO, Ano ang elevated natin? The left. So ang left lung field ay shorter. It appears shorter. Dahil magnification of the diaphragm. Magnified. Bakit nagkaroon ng magnification? Dahil mas malayo ang diaphragm doon sa X-ray table or doon nakaset. Di ba? Doon lang nagkakaroon lang ng magnification when the object is farther from the image receptor. Di ba? Doon lang nagkakaroon ng magnification. So in RPO and LPO, the heart and great vessels are also magnified. Di ba? So RPO and LPO, the heart and great vessels are also magnified. So that is the PA oblique projection. Magkaiba ang ini-evaluate natin ha? Magkaiba ang body rotation. So pag PA oblique projection of the chest, kung ini-evaluate natin ulit ay lungs, 45 degrees ang body rotation, both in RAO and LAO, or anterior oblique, or PA oblique. Kung ang ini-evaluate natin ay heart and great vessels, the body rotation ay 55 to 60 degrees. Only specifically in LAO. Kung ang i-demonstrate natin ay pulmonary disease, ang ini-evaluate natin, the body rotation should only be 10 to 20 degrees, both in RAO and LAO. Next question, number 58. Which of the following is an effective way to detect rotation of the patient with the PA projection? Radiograph the chest. Which of the following is an effective way to detect rotation of the patient in PA? O paano natin madidetect kung mayroong rotation ba ang chest x-ray sa PA projection of the chest? Madidetect ba kung mayroong rotation on the number of demonstrated above the diaphragm? Hindi natin madidetect yon. Dahil dito sa PA projection of the chest, laging tatandaan to have a quality chest x-ray, the pairs of ribs should be 10 pairs of ribs or more. Diba? So, ano ang tinitingnan natin? The asymmetrical appearance of the sternoclavicular joints. No, the appearance of the sternoclavicular joints. Saan nakikita natin ang sternoclavicular joints? The sternoclavicular joints can be seen in the medial end of the clavicle. Diba? Medial end. Ito. So dito sa medial end ng clavicle, that is the sternoclavicular joint. So sa lateral end ng clavicle, ano ang tawag ng joints na yon? Lateral end of the clavicle, that is acromioclavicular articulation. Diba? So the medial end of the clavicle, anong articulation or anong joint ang tawag doon? Sternoclavicular joints. Sa lateral end of the clavicle, anong joints ang nakikita doon? We have the acromioclavicular joint. So nakikita lang natin kung ang sternal ends of the clavicles are equidistant from the vertebral column. So doon natin makikita yung symmetrical appearance ng sternoclavicular joints kung meron bang rotation o wala sa PA projection. Diba? Sa PA projection, kung merong rotation o wala. Yan, okay? Next question, with reference to the image receptor, how are the mid-sagittal plane and the mid-coronal plane positioned for the AP chest, left lateral decubitus? Yan, ano daw with reference to the image receptor? Ano daw ang position ng mid-sagittal plane at saka mid-coronal plane kung ang pasyente ay AP? No? Kung ang pasyente ay for the AP chest or left lateral decubitus and left lateral decubitus position. So kung ang pasyente ay naka-AP, ano ang position ng mid-sagittal? The mid-sagittal plane is perpendicular, di ba? Dahil naka-AP. So mid-sagittal plane is perpendicular and dahil naka-left lateral decubitus, ano ang position ng mid-coronal plane? So the mid-coronal plane is parallel in relation to the image receptor. So the answer here, we have the MSP is mid-sagittal, or the mid-sagittal plane is perpendicular in AP projection of the chest in relation to the image receptor. And in lateral decubitus position, the mid-coronal plane is parallel in relation to the image receptor. So kung ang pasyente naka-decubitus, ang pasyente, ito yung hinahanap ko kanina class na doon sa decubitus. Sabi nga natin, kailan tayo nagde-decube? Kung ang dinidemonstrate natin ay air level or fluid level. Yan, nagde-decube. Pag kaya naman ng pasyenteng tumayo, it is advisable that the patient should be in upright position. So let's say, for example, nakalateral decubitus ang pasyente. Kung air level ang dinidemonstrate natin, kung air level ang dinidemonstrate natin, in other words, the unaffected side is close in contact to the tabletop. Tandaan class sa lateral decubitus, kung ang dinidemonstrate natin ay air level, the affected side should be close in contact to the tabletop. Kung ang air niyan ay nasa pleural cavity. Kung ang dinidemonstrate naman natin ay small amount of fluid in the pleural cavity, the affected side should be close in contact. So I repeat, kung air level ang dinidemonstrate natin, the unaffected side should be close in contact to the tabletop. Unaffected side. So, ibig sabihin, ang affected, nasa itaas. Nasa itaas. Ang unaffected, yun ang naka-close in contact sa tabletop. Pero before the exposure be made, the patient should stay in that position in the lateral decubitus for 5 minutes before the exposure be made. Bakit kailangan 5 minutes? Minimum of 5 minutes, maximum of 15 to 20 minutes na ang pasyente ay naka-lateral decube. Yan, in order to demonstrate yan ng small amount of fluid or the air level in the pleural cavity. Bakit 5 minutes minimum? This allows fluid to settle. Halimbawa, sa fluid ang dinidemonstrate natin, the affected side should be close in contact. So baka may mga fluid pa na nandito sa unaffected, bababa yun na makikita. Or kung ang dinidemonstrate naman natin ay air level, baka naman may mga air dito sa affected, sa unaffected na kailangan tumaas din. So yun din ang purpose natin. No? Kaya 5 minutes before the exposure, the patient should be in that position for 5 minutes minimum, maximum of 15 to 20 minutes. I repeat, sa lateral decubitus, kung fluid level, the affected side should be close in contact. No? Kung air level, the unaffected side should be close in contact. Yan. So yan ang decubitus natin. Next number, which procedure can be performed to better demonstrate the 7th, 8th, and 9th ribs away from the shadow of the diaphragm? 7th, 8th, and 9th ribs away from the shadow of the diaphragm. So the instructions here or our answer here is central ray is directed perpendicular to T7. Pero hindi din ako sure class sa sagot ko. No? And today, that is our end. Dito lang muna tayo mag-end. And please review, pakibasa ulit itong question na ito. And tomorrow, we will discuss this. No? Bukas, ang klase natin, class will start at 9 o'clock. No? 9 o'clock tayo bukas for the continuation of the discussions or rationalization. Do you have any question, class? Palagay na lang din class ng mga answers nyo doon sa Richard. Nabigyan na ba sila ng Google Form? So pasagot na lang din muna ng mga answers nyo sa Google Form and submit it to Equip para at least makita natin yung results tomorrow. We will discuss, no? Titingnan natin ano ba yung mga results na nakuha niyo.
Thank you, sir.
Okay, do you have any questions? Meron dito, naka-attend, nag-enroll siya doon sa Maharlika promo. Ang Maharlika promo natin ay dynamic online, itong ginagawa natin, and face-to-face, di ba? Ngayon, gusto niyang mag-shift doon sa online review. Ganun pa rin po ang babayaran niyo. Hindi na natin ma-change yung payments na ginawa niyo. Ayan. Okay, do you have questions, class? Any questions? Or you can ask questions tomorrow, class, before we start. Yan. Okay, thank you very much for listening. So that is only for today. Tomorrow, ang klase natin ay 9 o'clock in the morning. Mamaya may magte-text ulit yan. Anong klase bukas? Nako, RADTECH. Class, ako yung sumasagot doon kaya suplado
Thank you, sir.
ako. Oo. Kasi paulit-ulit, di ba class? Nakakainis. Tipain ko yung mga mukha nyo eh. Yan, so see you tomorrow class. Thank you, mag-iingat. Maulan, malakas ang ulan. Thank you,
Thank you,
God
sir.
bless. God
Thank
bless
you, sir.
everyone. Thank you.
Thank you po, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Umayos kayo class, mag-aral kayo ha. Nako,
Opo.
mag-aral na mabuti.
Thank you, sir.
Okay then, thank you, God bless everyone.
Thank you, sir.